Okay, so I've come in a room, I provided the patient with privacy, I've washed my hands, and I've checked the chart for any orders. Hi, my name is T. I'll be your student nurse today. Can I have your first and last name?
Tamia Albert.
And your date of birth?
11/30/1997.
Okay, and what brings you in today?
I'm just here for a physical.
Alright, so before we get started, are you currently in any pain right now?
No.
Alright, so just start by asking you a couple of questions. So do you suffer from headaches often?
No.
Migraines?
No.
Do you notice your hair thinning or falling out?
No.
Excessive dandruff or anything?
Mm-mm.
Okay, so looking at the patient's head size, it does look normal cephalic. I don't note any lesions or masses or bumps or anything. So I'm going to start by palpating your scalp. If you feel any pain at any time, you're going to let me know. Okay, so I'm feeling around in the patient's head. I don't feel any bumps, nodules, or masses or anything. Her hair texture is a soft, curly texture. Her hair, as far as her eyebrows and eyelashes, is evenly distributed. Her skin color is normal for ethnicity. I don't know any jaundice or cyanosis or anything. So next thing we're going to do, we're going to move down to your eyes. Do you wear eyeglasses?
No.
Do you remember the last time you visited your eye doctor?
About a month ago.
Do you have any problems seeing like at night or anything?
Mm-mm.
Watery eyes?
Mm-mm.
Or dry eyes?
Yep.
Okay, so looking at the patient's eyes and the outside cameras of the eyes does look normal. They don't look dry or moist or anything. Her pupils are normal and round. I'll give them about a size 5. I'll rate people at a size 5. Her sclera and conjunctiva. Sclera is nice and white, conjunctiva nice and pink and moist. So we're going to do a couple things with your eyes. We're going to test your 6 gazes with your eyes. So you want to follow the pen light with your eyes. Try not to move your head. So I'm going to start here. Okay, so the next thing we're going to do, we're going to check your eyes for accommodation. So I'll start my pen light back here and bring it closer to your nose. Once it gets closer to your face, you want to focus on the object. Okay, so we'll start here. And I'll drag it in. Okay, so the patient's eyes was able to accommodate for the light change in the size and the direction of the eyes to focus on the object in front of her. So the next thing we're going to do, I'm going to test your eyes for direct and consensual constriction. So I'll flash a light into your eyes 2 times, twice in each eyeball. So we'll start here. Okay. There we go. Okay. So the eyes did constrict directly and consensually to light, is what we were looking for. So the next thing we're going to do, I'm going to palpate your sinuses. You want to let me know if you feel any pain here. Any pain here?
No.
Okay, so the sinuses are clear. So we'll do your skin turgor and your supraclavicular area. So the skin did retract instantly, which says that the patient is adequately hydrated. Next thing we're going to push on your tragus. Any pain?
No.
Pull up on your pinna. Any pain?
Nope.
And we're going to push on your mastoid process. Any pain?
Mm-mm.
Okay. So next thing we're going to do, we're going to palpate your 10 lymph nodes, starting with your pre-auricular, post-auricular, your occipital. Then we'll move down to your tonsillar, submandibular, submental, your post-cervical, posterior cervical, and your anterior cervical. Then you want to hunch your shoulders forward. We'll do your supraclavicular. Okay, so I didn't feel any of your lymph nodes, which was a good sign. Had I did feel them, that would be a sign of that's an abnormal sign. So if I did feel that, we'll investigate further. Next thing we're going to do, we're going to try to push your face towards my hand. Okay. Okay, so the patient neck strip is intact. She was able to push her neck against resistance. Can you shrug your shoulders up? One more time. Okay, and so cranial nerves 3, 4, and 6 is intact. Cranial nerve 11 is intact. The patient was able to shrug her shoulders up and down. Next we're going to test your cranial nerve 5 TMJ. Can you open your mouth? Close it again. Open. Can you move your jaw side to side? Okay, so TMJ is intact. The patient is able to move her jaws up and down, side to side. Can you puff out your cheeks? Smile, frown, and raise your eyebrows. All right, so the next thing we're going to do, we're going to test some facial sensations. You want to tell me if the sensation on your face is sharp or dull. So I'll start here.
Dull. Sharp. Dull. Sharp.
Okay, so that is good. So the next thing we're going to do, we're going to move down to your nose. So do you have any issues with your nose?
No.
Do you smell adequately? Do you notice like any drainage from your nose? Any nosebleeds?
No.
Have you ever broken your nose? Okay, so the patient's nose does look midline. Her nerve sizes are normally not, nasal flaring. The skin of her nose isn't peeling or anything. So we'll look up your nose. Your nose is pink and moist. There's no deviations or perforations or anything. So can you include one nostril and breathe in? Okay, include the other nostril and breathe in. Okay, so the patient's nostrils are patent, which means they are open, which is a normal finding. So with that being said, the patient's cranial nerves 1 and 2 is intact. The patient is able to smell, and she doesn't need a Snellen eye chart because she sees her eye doctor regularly and doesn't wear glasses. So the next thing we're going to do, we're going to move down to your chest area. So as far as your chest, do you notice shortness of breath or anything? Any pain in your chest? Do you feel like your heart or anything skips any beats or anything?
No.
Do you find it hard to breathe after you climb a set of stairs or anything?
No.
Okay, so looking at the patient's chest, the patient is relaxed. She doesn't seem to be tense or anything. She doesn't seem to be using any accessory muscles. She doesn't seem to be in respiratory distress. Her skin is warm and dry to the touch. I don't know any crepitus on her chest or anything. Okay, so the first thing we're going to do is we're going to listen to your lung sounds on your chest. So with that being said, I will have to lift your shirt up, or you can take it off, whichever one you're most comfortable with. So the first thing we're going to do is we're going to listen to all of your lung fields, starting at the top, moving all the way down, over and over to T8 up to T6 also. All right. So lift up here and take a breath in and out. In and out. And take a breath in and out. In and out. Alright, so we'll go under. Sorry. And over here. Okay, so the facial lung sounds are clear. I didn't know any bronchi or wheezing or anything, so your lungs were clear throughout. So the next thing we're gonna do, we're gonna percuss in those same areas. I'll have you hold your shirt up here if you can. We'll start up here. Sure got no way. Come here. Okay, so your lung sounds were resonant throughout, which is what we were looking for. So the next thing we're gonna do is we're gonna listen to your heart sound. So I'm gonna map out my field first, and then we'll listen. So we're gonna hold your shirt up one more time. So we'll start at the sternal notch, which is about right here, down to the angle of Louis, down to the second intercostal space, right sternal border, which is the aortic, over to the second intercostal space, left sternal border, which is the pulmonic, down to the third intercostal space, left sternal border, which is the Erb's point. Then we'll go down to the fifth intercostal space, left sternal border, which is the tricuspid, over to the fifth intercostal space, mid-clavicular line, which is the point of maximum impulse. And this is the same area we'll look for any lifts or heaves, and I don't see any of those. So next thing we're going to do, we're going to listen to your heart sounds in those same areas I just pointed out. So second intercostal space at the aortic, second intercostal space at the pulmonic, third intercostal space, left sternal border, Erb's point, down to the fifth intercostal space, fifth intercostal space, the point of maximum impulse. Okay, so your heart sounds were normal. I did note S1 and S2, which were normal. I didn't hear any extra heartbeats or any murmurs or anything. So next thing we're gonna do, can you squeeze my fingers? Can you push, pull, All right, so the patient arm strip is intact, so we'll texture a cat refill on your fingers. Okay, so next thing I'm gonna do, can you lay back? So looking at the patient's neck, I don't know any JVD. If I did, I'll have the patient sit up 45 degrees and we'll check that again. You wanna scoot up on the bed some. All right, you can stretch out. So the next thing we're gonna do, looking at the patient's body, she does look relaxed. Her skin is warm and dry to the touch. Her hair is evenly distributed throughout. So the next thing I'm gonna do, I'm gonna palpate your temporal arteries. I'll rate those as a equally bilateral +2. I'll come down to your brachial. Those are also equally bilateral +2. We'll come down to your radial pulses. Those are both also equally bilateral +2. Normally we will palpate your femoral pulses also, but we'll skip that for this video. We'll come down to your popliteal behind the knee. That one is about a +1. That's about faint a little bit. Do this one. This one is also faint. I'll rate that as a +1 also. We'll come down to your posterior tibial. I will also rate those as a +2 equal bilateral. We'll come to your dorsal pedis at the top of the foot. Those are also equally bilateral +2. We'll check your cat refill. The patient does have nail polish on, so we'll do it at the bottom of the foot. Okay, so the cat refill was about less than 3 seconds, which is normal. So next thing, I'll check your Babinski reflex on your foot. Okay. All right, so the patient does react to that. Her toes did curl in. The next thing I'm going to do is I'm going to touch your foot, and you want to tell me if the sensation, if it's soft or dull.
Okay.
Soft or sharp, I'm sorry.
Soft. Sharp. Soft. Sharp.
Okay, so can you raise this foot up off the bed? Okay, can you raise this foot up off the bed? Okay, so there is no edema or anything noted here. No edema or anything noted here. So the next thing we're going to do, we're going to inspect your abdomen. So with your stomach, are you currently in any pain right now?
Mm-mm.
Do you have to use the restroom?
No.
So as far as your stomach, do you have normal bowel movements?
Yes.
Do you urinate normally?
Yes.
Do you notice any blood in your stool?
Mm-mm.
Any pus in your urine?
Nope.
And do you have regular menstrual cycles?
Yes.
Okay. And with your menstrual cycles, do you perform self-breast examinations?
No.
Okay. So a good piece with that, about a week after your menstrual cycle is a good time to check your breast for any lumps or masses or anything. How you would do that, you would stand in front of the mirror with your arms on your hips, and you would just check the contour of each breast, make sure they're the same, no noticeable bumps or masses. Another thing you do is you lay flat in the bed with one arm behind your head. You want to start in your armpit, in a circular motion, come out to the breast, all the way to the nipple.
Mm-hmm.
In the circular motion, what you're feeling for is any lumps or masses. If you did feel those, you would want to go to the doctor or anything.
Okay.
Okay, so moving forward, looking at the patient's abdomen, it is a flat contour. I don't know any pulsations or any bumps or masses or anything. Her umbilicus is midline. So the first thing we're going to do is we're going to listen to your bowel sounds in all 4 quadrants, starting with the lower right. Okay. So we'll start here. Okay, so the patient's bowel sounds were present. They wasn't hyperactive or hypoactive, what we were looking for. The next thing we're going to do is we're going to we're going to listen to your iliac and your renal and aortic sounds in your stomach for any bruit. So how we do that, we'll put 3 fingers here and I'll listen to in these 3 areas with the bell of my stethoscope. Okay, so listen here. to listen to your iliac also. Okay, so I didn't know any roots in those areas, which is what we were looking for. So the next thing we're going to do, we're going to percuss in those same areas, starting here. Put your arms to your side. Okay, so your word tympani throughout is what we were looking for. If there were any dullness, that note there was some fluid or something in your belly. So the next thing we're gonna do light percussion in the same order that we did the rest of the exam. So we'll start here. Okay, so I didn't know any bumps, masses, or anything what we were looking for. So the next thing we're gonna do deep palpitation, which is a little bit uncomfortable. If it starts to hurt or anything, you just wanna let me know and I'll stop. So we'll go a little bit deeper. Any pain?
Nope.
Okay, good. So I didn't know any lumps or mass or anything, so you can go ahead and sit up. You want to come back down to the edge of the bed. So another test I'll have you do. So first of all, we're gonna do your mouth. I completely skipped it. So do you have any issues with your mouth, such like dry mouth or anything?
No.
Can you taste your food adequately?
Mm-hmm.
Do your gums bleed or anything when you brush your teeth? All right. So looking at the patient's lips, her lips are pink and moist. They don't seem dry. Can you smile? All right, can you open your mouth? Can you say ah, stick your tongue out? Okay, can you lift your tongue up? All right, so looking in the patient's mouth, her tonsils are not present. Did you have your tonsils removed?
Yes.
Okay, so her tonsils are not present, so we can't grade them. Her tongue is midline. I did note the rise and drop of her uvula, which is also midline. Her pharyngeal wall, hard and soft palate, the muca, mucosa in the tongue, because the whole mouth is also pink and moist, which is what we were looking for. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, so that does say cranial nerve 12 is intact. The patient was able to say light, tight, dynamite. Cranial nerve 9 and 10 is also intact. The patient was able to stick her tongue out and say ah, and her tongue is midline. The next thing we're going to do, I have you stand up. Can you put your arms out to your sides? Can you touch the tip of your nose? All right, you want to alternate tip of your nose. And can you run your heel down your shin? Same with the other leg. Okay, and can you walk to the wall and come back? Okay. All right, so you can go ahead and have a seat. Your gait was normal. So another thing we're going to do is your ears. So do you hear normally?
Yes.
Do you notice like any drainage or anything from your ears?
Mm-mm.
Any ringing in your ears? Have you ever had like any surgeries on your ears?
No.
Any tubes placed in your ears?
Mm-mm.
So looking at the patient ears, the ears do seem symmetrical. They are lined up with the outer canvas of the eye, which means they are normal size. Looking in the ear is a normal amount of cerumen in the ears. Same on this side, normal amount of cerumen. So another thing we're gonna do a whisper test. So I'll stand behind you and I'll whisper. You tell me what side and what word you heard. You can turn this way.
Table right. Apple left.
Okay, so which side do you hear the noise?
Right.
Which side do you hear the noise?
Left.
Okay. So the next thing I'm gonna do you know where you are right now?
Yes, I'm at the doctor's office.
And do you know what today's date is?
Today's December the 3rd, 2019.
And do you know who our president is?
Donald Trump.
Okay, so looking at the patient, we have went through the majority of her exam. She was able to respond to my questions. She was alert and oriented. She didn't seem to be anxious or anything. No involuntary movements. She did have a relaxed affect. She was nervous. She was alert to time, place, and person. So I'll give her a Glasgow Coma scale of 15. She is ANO times 3. She did respond properly to all of my questions. So with that being said, I think yep, we gotta do your whole back. I forgot the whole back. So next thing we're gonna do, I have you turn this way. I'll have you lift your shirt up. Okay, so next thing we're gonna do is we're gonna inspect the patient's back. So looking at her back, it does look normal in size, normal to ethnicity. I don't know any jaundice or cyanosis. No crepitus or anything on the back. So next thing I'm gonna do, I'll take your tactile firmness. So every time you feel my hands on your back, I want you to say 99.
Okay. 99, 99, 99, 99, 99, 99.
Okay, so her tactile firmness was normal. I did note the decrease in vibration as I went down her back. So the next thing we're going to do is I'm going to map out my field. So we'll start here at C7, the vertebral prominence, down to the bottom of her scapula, which is about right here, down to T10, 2, 3. So I'll pinch it in. Can you breathe in and breathe out? All right, so her symmetrical expansion is normal. So we'll take her AP diameter. Have you put your arm up and I'll come around to the back. It is a 2-to-1 ratio is what we were looking for. You can put your arm down. So the next thing we're going to do is we're going to listen to your entire lung field on your back. All right. And take a breath. 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 Here. You're going to also go over to T8. Going over a little bit. Up to T6. And do the same over here, T8. Okay, so the patient lungs field were clear throughout. I didn't know any wheezing, rhonchi, or bronchial sounds or anything. So the next thing we're going to do is we're going to percuss in those same areas. I'll start here. Okay, so the percussion, she was resonant throughout, which what we were looking for. So with that being said, I think everything is all good on your back. So I'll have you put that down. All right, so now I think we're all set. So you just want to hang tight. The doctor will be with you shortly.
Thank you.
Thank you.